Hi, Mr. Stoppelheim. I'm Dr. Anya Meredith, and you've come in to talk to us today. Am I okay to call you Mr. Stoppelheim, or would you prefer something else?
No, no, Mr. Stoppelheim's fine, thank you. Um, uh, Basically, I'm pretty fit and well, and I enjoy running. But just recently, I found I can't run as far as I used to. I can't run as fast as I used to. It takes me ages to get my breath back afterwards, and I just don't know what's sort of going on. I just want to get back to running properly again, really.
Okay, and have you found that you've been breathless just when you're running, or do you find that you're breathless when you're resting or anything like that as well?
No, I don't think so. It doesn't happen just normally at home. No, it's just when I'm running. I mean, I usually do about 5K, something like that, at the local park. I'm lucky if I can do half that now, and I have to literally have to stop and just get my breath back. It's ridiculous.
Okay, I'm sorry to hear that. And do you find that it takes you a while then to get your breath back? Would you be short of breath for quite a while after?
Yeah, it takes me longer than it used to. Yeah, definitely.
Okay, and have you got any problems sleeping or lying down on your back at all?
No, no, not at all.
Okay, and have you noticed any change in your weight recently, putting on weight or losing weight?
Um, No, it's a bit. Well, I haven't weighed myself, to be honest, but my friends have sort of said that I seem to be losing weight, and I must admit my clothes are fitting more loosely. But I mean, presumably that can't be the case because I'm not doing as much exercise. So, if anything, I'm probably putting on weight, but I don't know. It just does seem a bit odd. Yeah.
Okay, and what about any pain? Do you have any pain in your chest or your back or anywhere?
No. Yeah, my back actually. My chest is fine. My
Okay, and
my my
where in your
back
back?
is sort of right down at the bottom, sort of lower back. Yeah, just a sort
Mhm.
of
And has
yeah,
that been going on a
yeah,
while?
yeah. It has. It's yeah. Just sort of over the last, I don't know, couple of months, 2, 3 months.
Okay, and does it get worse when you're moving, or is it a constant pain?
No, well, both really. Probably, so it doesn't make much sense, does it? But it feels like it's there all the time, and then it gets even worse if I have to sort of move or anything like that.
Okay, and what about any flu-like symptoms? Have you had any fever recently or infections or anything like that?
No, no, I haven't. No.
Okay. And what about have you had a cough recently or anything like that? Yeah, have you been coughing?
Um, not well. I did have one episode of a cough where I just sort of coughed quite heavily, and there was a bit of blood that came up with the cough.
Okay.
Yeah, I don't know. It was sort of. I don't think it's sort of relevant really, because it's just because I coughed really hard, and if you cough really hard, you can sort of catch your throat a bit.
Yeah. And what have you got any chest tightness or any asthma, history of asthma or anything like that?
Um, well, not really. I mean, I did have. I have had sort of a cough for quite a long time, but just a sort of more general cough. And I normally do get some, chest infections, that sort of thing. But usually just over the winter. And so I have a flu jab every year. That never seems to work. I've got inhalers, but I don't really use them. I don't really need to use them. So but no, I don't get any chest tightness. I just sort of get, I don't know, just don't know. It feels like more and more like infections and things.
Okay, so you've just to summarize for you, Mr. Stoppelheim, you've had shortness of breath when you're running, and you've got lower back pain, and you coughed up a little bit of blood.
Yeah.
And okay, and what can I ask you a little bit about your family history, medical history? Is that okay?
Well, my father, died when he was the age I am now. It's just weird. He had lung cancer. But no, I've got two brothers, one older, one younger. They're both fit and well. Yeah.
Okay, I'm sorry about your father. Is your mother still? Does she live close by to you?
Well, she's actually dependent on me. I'm her carer. Since she's had the strokes, she basically, she can't really do anything, washing, cooking, feeding herself. I'm kind of, she's reliant on me for all of it. Obviously, hoping that this is just something which we can just sort of make go away, because I don't know what she's going to do after, without me. Being at my sort of fittest, I can't afford not to be firing all cylinders.
Of course. Well, I'll send you for some further tests, if that's all right with you. And just to maybe we'll do an x-ray on your chest and have a look there. If you're having problems with your breathing, I think that's probably the best. And if you have a history of lung cancer, I think it's best that we look for that as well. Does that sound okay to you?
I guess so, but I wouldn't have to stay in, would I? Because I don't know what's going to happen to my mum if I have to stay in the hospital at all. I don't know how she'll cope.
I'll have a look if we can get you in and out in a few hours, and we'll try and not have you overnight, and we'll get the test done as quick as we can.
Okay, thank you, doctor.
Okay, thank you very much.
Thank you.